So you're about to travel abroad and the pandemic still hasn't ended. What do you need to know to make sure you have a safe and successful experience? This video will help you think through different considerations for your trip as you plan, travel to your host country, spend time abroad, and finally return to the U.S. Keep in mind that although we've tried to make this as broad as possible, rules and restrictions around COVID-19 continue to change, and the pandemic is still unpredictable. Ultimately, it's your responsibility to ensure you understand the situation in your host country before traveling and consider your own personal risk tolerance in the context of the pandemic. Part 1. Pre-departure planning. The first thing you need to do to prepare for international travel is to get an understanding of what the pandemic looks like where you're going. COVID-19 is affecting different countries in different ways. Some places may be totally open to U.S. visitors, while others may have complicated vaccination, entry, or quarantine requirements. In places that don't require masking or social distancing, things may feel totally normal. But in other countries, taking your mask off in a public space may result in you receiving a fine. Everything about the pandemic depends on the context, so understanding your host country is critical. There are many different resources that you can use to research your destination. First, the U.S. Embassy in each country has a COVID-specific webpage. These are updated regularly and provide information about entry requirements, restrictions within the country, and more. Some countries may require proof of vaccination to enter. Some may require proof of a negative test, and some may require both. It's important to understand requirements that will affect you as you plan, because if you go to the airport with the wrong documentation, you won't be able to board your flight. In addition to understanding baseline entry requirements and restrictions, it's important to wrap your head around how the pandemic is affecting your host country's medical system and how that might be different from what is happening here in the U.S. We recommend 3 different websites to explore this. First, Harvard and Brown universities have put together a COVID risk map, which color codes every country in the world based on the number of new cases they're currently experiencing. It's an easy way to visualize how COVID is affecting your destination compared to how it's affecting the U.S. or even Kentucky. There are also charts available on the site that let you see how the numbers have changed over time. Next, take some time to explore the COVID-19 information available from Our World in Data. Their site makes it easy to compare different trends across countries, and you can even see things like host country hospitalizations, vaccination rates, and more. Finally, the IHME model tries to predict what the spread of COVID is likely to look like in different countries in the near future. This should at least give you an idea of the trajectory of new cases, but keep in mind that the pandemic has been very unpredictable, so you should only use this as a baseline. UK's travel medical insurance and assistant provider, AXA Assistance, provides additional pre-departure resources in their smartphone app. Information about how to access these resources is included in another video. You can always ask your contact in the UK International Centre for more information too. After you've researched your host country, here are some questions to ask yourself. Are you fully vaccinated? Do you know what restrictions your host country has in place for visitors? Are things open as normal or not? If there are restrictions in place, how will they affect your ability to meet the goals that you have for your time abroad? Do you know what documentation you need to ensure you can gain entry into your host country? What does the pandemic itself look like at your destination? Are the numbers of new cases higher or lower than they are here? Is the medical infrastructure in your host country under strain? If it is, what implications could that have for your health and wellness? The UK International Centre is always here to help you prepare for your time abroad. However, ultimately, it's your responsibility to understand the risk landscapes in your host country, to be fully prepared for travel, and to advocate for your own health and wellness while you are overseas. Part 2. Traveling and entering your host country. So, you've researched your destination. You understand the entry requirements, what you have to do upon arrival, what restrictions are in place, and how the pandemic is unfolding in that country. But what considerations should you take as you're preparing for your actual flight? First and foremost, we strongly recommend you be fully vaccinated before your travel date. In your research, you'll learn that some countries won't allow you to enter at all without being vaccinated. Others may require you to spend a long period of time in quarantine. And once you're out of quarantine, you may be unable to access restaurants, cultural sites, or other public spaces without being able to show proof of vaccination. Most importantly, being fully vaccinated is the best way to protect yourself against becoming infected and getting sick. Keep in mind that those countries that require vaccination may not recognize a religious or medical exemption that you have received in the U.S. Even after you are fully vaccinated, we recommend you limit your social interactions in the 10 days before your flight. Even vaccinated people can contract and spread COVID-19 without even knowing they have it. The last thing you want to do is become an asymptomatic carrier and unintentionally transmit the virus to the host community you are visiting. To help avoid this, we also recommend you get a COVID test before you leave the U.S., just to ensure you are negative. Some countries may require that you test before entering, so be sure that you get the test within whatever time frame your destination requires. If your destination doesn't require a negative test for entry or doesn't have a required time frame, we recommend that you take the test no earlier than 72 hours before your flight. If you test positive or you believe that you have COVID symptoms, isolate yourself and do not travel. Contact the UK International Centre and we'll help you with the next steps. On the day of your flight, get to the airport early. Traveling internationally right now often requires much more documentation than just your passport, so the lines may be longer than you're used to. Make sure that you have all the documents you need, including your passport, negative test results, and proof of vaccination if required. You should take your CDC vaccination record with you, but also have digital copies, like photos on your phone, in case you lose your physical card. It's also critical to ensure your vaccine card is filled out correctly, with all dates, information, and signatures included. If during your pre-departure research you learn that your host country has a required health pass or app that you must have on your phone, make sure that that's ready to go before you arrive at the airport. You might be required to wear a mask, practice social distancing during the check-in process, and once you board your flight. Any requirements around masking or social distancing are non-negotiable. If you refuse to comply for any reason, you'll likely be removed from your flight and possibly even banned from future flights by the airline. Once you land, there will be signs that direct you to the appropriate customs and immigration area. Remember, you're not in the U.S. anymore. This will be your first experience with your host country's COVID guidelines and restrictions, so be sure to follow any instructions you're given by authorities on site. Be prepared to show all your documentation to immigration officials. A short time later, you'll find yourself at the airport's exit. You're a little disoriented and jet lagged, but you've passed through the border and entered your host country. Take a second to look around. All your preparation has paid off. Part 3. While abroad. While you are in your host country, the most important thing to remember is that its responses to the pandemic and any restrictions that it may have implemented might be totally different than what you have experienced in the U.S., so leave your assumptions at the airport. Many countries require you to show proof of vaccination, either via your CDC card or a smartphone app, to enter restaurants, cultural sites, or other public venues. If your country has such a requirement, it's very important that you always keep the appropriate documentation with you. Other countries may have masking requirements that are much more restrictive than what you are used to. In some places, these are truly not optional. And if you choose not to comply, you may be fined. Throughout the entire time you're in your host country, it's important to take all steps recommended by local authorities to avoid contracting COVID. Although unlikely, it's still possible to contract the virus if you are fully vaccinated, and the last thing you want is to get sick during your time abroad. However, if you do get sick, remember that the UK International Center can assist you in locating appropriate medical care and using the travel medical insurance that you have through the university. Make sure you understand how to use that coverage throughout your trip in case you need it. If you believe you're experiencing COVID symptoms, isolate yourself and contact either the UK International Center or an appropriate on-site contact for guidance on next steps. If you do contract COVID-19, you may end up totally asymptomatic. However, even this is something you want to do everything you can to avoid. First, because you may transmit the virus to people in your host community who might be at higher risk of complications or have not been able to get vaccinated yet. But also because in some countries, COVID tests may be required to enter certain museums, to pass between provinces or states, or in other situations. If you encounter this and you test positive, you may then be required to self-isolate by your host government. Not only could that result in you missing out on valuable time at your destination, it could result in considerable unplanned expenses if you must stay in a government-mandated hotel at your own cost. Also, remember that if you become sick or have to go into isolation, it's very unlikely that anyone from the U.S. will be able to come see you. In some cases, it may not even be possible for a friend, parent, or spouse to enter your host country without a visa. So this is another reason to take all the precautions that you can. While you are abroad, you may be tempted to visit other countries during free time, especially if they are relatively close by. However, we recommend that you consider this very carefully and that you deeply understand the context before doing so. In many places, you have to submit COVID test results, vaccine documentation, and more each time you cross a border. Regulations vary widely, and this can become a very confusing process. If there is a new variant, or if case numbers spike rapidly, the border may close altogether. If it turns out you are unable to re-enter your host country, there won't be much the university can do to assist you. You will be subject to the regulations and restrictions in place where you are. While things are getting easier over time, international travel just isn't the same right now as it was before the pandemic. And there will still be some significant logistical challenges. Part 4. Returning to the U.S. As your time abroad draws to an end, it will be time to start thinking about what you need to do to prepare to return to the U.S. At the time that this video was made, all returning travelers to the U.S. were required to submit a negative COVID test taken no more than 24 hours before their flight. There are almost no exceptions to this requirement, and if you test positive at this point, you will not be allowed to return as scheduled. This is another important reason to do everything you can to avoid contracting COVID-19 while you're abroad. If you're unable to return as planned, it could result in serious disruptions. It could also result in you having to spend a significant amount of money on hotels and other costs until you are allowed to re-enter the U.S., and you will be responsible for those costs. It is absolutely critical that you understand the return testing requirements for the U.S. before the end of your time overseas, in case this rule has changed by the time you travel. Reach out to your contact in the UK International Center if you have specific questions, and we can help. Remember, all the same considerations that you took during your journey from the U.S. to your destination will apply as you return to the U.S. Make sure you have the appropriate return documentation prepared in the correct format, and again, get to the airport early. Follow all instructions given to you by on-site authorities, both at your departure airport and upon arrival in the U.S. Finally, Be sure that you understand the latest guidance from the CDC about what to do after an international trip. Even if you are fully vaccinated, there may be recommendations about getting a COVID test a certain number of days after you get home, just to be sure that you didn't become infected during transit.
Created using Powtoon.